Well, welcome everyone to our 50th anniversary webinar series. I'm Dr. Ron Yee, and I have the privilege of serving as the Chief Medical Officer at NAC and host for today's event. We're so grateful to you all for joining us and to our nationally renowned speakers for lending their voices to our discussion celebrating the incredible dedication and perseverance of our health center workforce. To kick things off today, it's my pleasure to introduce NAC's President and CEO, Tom Van Coverden, with some welcoming remarks. Tom?
Dr. Yee, thank you very much for that. And I just want to, on behalf of all of our nation's community health centers, give a big shout out and thank you to the Surgeon General, Dr. Murthy, for having and being with us, not only now, but during this whole experience with COVID and beyond. I know I've been with NAC now for better than 45 years and worked for the Congress before that, and never have I seen really a number of you, but for so long, I say a big thank you to the president, to the vice president who were there with you visiting health centers, knowing firsthand, as you, Dr. Murthy, and your team, your entire set of teams, really what the health centers were doing in the most medically underserved areas. To do that, and that has really never happened before in our full history, to have that kind of coverage and unity and message and purpose in what we're trying to do. You were there every step of the way. So number one is a big thank you to you and all of you for that effort and that teamwork. And team is the word, Ron. Dr. Yee, I think you mentioned we're all gonna hear many times over. I think the results we produced together have been incredible, and it would not have happened without you. As I look at it, going back, whether it was the HRSA agency, the CDC, the Centers for Disease Control, the Food and Drug Administration, National Institutes of Health, again, everybody was working off the same song sheet. And for the first time, health centers received the frontline support that they needed with a direct shipment of supplies, of testing, materials, of vaccine products, and supplies again, and support for the staff at every step of the way to make sure we were meeting our goal. In addition to working to expand the financing for services such as telehealth and behavioral health that were so important to so many of our communities and made all the difference in the world, whether it's working with churches, whether it was working with prisons, whether it was working with agricultural workers in the field, you were there every step of the way working with us. And we so appreciate all of the effort that you have put into it. Let me just say, as we look ahead, know that we're going to be there with you, that we couldn't ask for a better partnership than we have currently with all of you. And if the health centers on the front line, with their community-based, consumer-driven boards of directors who played a huge role in outreach, working with churches, working with schools, working with other organizations, played a big role. Again, it was the doctors and the nurses as well, supply. But so much of the muscle and brain power came really with your agency and the Department of Health and Human Services in providing the direct support, which made all the difference in the world. So again, we're going to be with you going forward. We need to be with you and working very, very closely. With that, Dr. Yee, I'll turn it back to you. And again, a big thank you to everybody.
Thanks so much, Tom. Well, now I have the pleasure of introducing NAC's Senior Advisor for Clinical Workforce, past National Service Corps Director of 15 years, and retired commission officer in the United States Public Health Service, Dr. Don Weaver, to help kick off NAC's celebration of health center workforce. So Don, please share what you have with us today.
Thanks, Ron. This brief spotlight could have easily been a floodlight. However, in the interest of time, we will highlight a few of the thousands of examples we've received of the amazing work that you're doing on the front lines to address the health in your communities. Next slide, please. Oh, next one after that, thank you. We are here to celebrate the over 250,000 dedicated individuals who work at over 1,400 health centers, serving over 29 million health center patients nationwide. Thank you, thank you, thank you. We are daily in awe of the stories about the work you do to improve the health of the communities you're privileged to serve. with a goal of optimal health for all. Health centers also improve the economic health of their communities. Next slide, please. This slide highlights the important role that health centers play, not only as employers, but their contribution to the economic health of the community. It is estimated that for every dollar that the federal government invests in health centers, there is a close to $6 return in economic activity, as outlined by this slide. And in 2019, that total was $63.4 billion. By the COVID-19 pandemic, the health center workforce continues to deliver high quality, patient-centered, comprehensive care to an increasing number of medically underserved individuals who come to our health centers with complex health conditions. Additionally, with its foundation in social justice, health centers have renewed their commitment to diversity, equity, and inclusion. With regard to COVID-19, let's look at some of your results. Next slide, please. The COVID-19 pandemic has fueled shifts in the way healthcare is delivered and managed, including a dramatic rise in telehealth and remote work. Community health centers have cared for COVID-19 patients, supported the mental health of their communities, administered COVID-19 tests and treatments, and put shots in arms. And during this crisis, health centers have embraced innovative care models with a team-based approach, with the greater use of technology to bridge the gaps in care. Next slide, please. Let's look at a few of these examples. When the Rhode Island Department of Health was concerned about inequity in vaccine distribution, Blackstone Valley Community Healthcare recruited and deployed community health workers to what the health department called cold spots for door-to-door distribution of masks, hand sanitizer, and vaccine information resources. Going across the country to the Virginia Garcia Memorial Health Center in Oregon, a state law had been passed in 2019 which allowed dentists to administer all vaccine. To increase the number of members of their care team that could provide vaccinations, their dental team used the Oregon Health Science University's training program to make sure that they were all set to help put shots in arms as well, and a successful job they did. Health center pharmacy staff have been the foundation of the COVID-19 vaccine teams at Mariposa Community Health Center in Arizona and Holyoke Health Center's mass vaccinations for teachers in Holyoke, Massachusetts. And South Boston Community Health Center built a custom electronic health record report to help nurses manage their patients with COVID-19. The takeaway from these and so many other examples is it takes a village. It's about teams, from the front desk to those in the exam rooms, to those in the community, to the administration staff. Everyone has rallied and come together to address the needs in their community. So how can we help assure our teams are staffed for the future to have continuing success? Next slide, please. We call this growing our own. I think there's increasing evidence that individuals that are trained in health centers are much, much more likely to remain in health centers for their professional career. As Grace Wong has reminded us on a number of occasions, teaching is in health centers' DNA. And since we've seemed to grow in leaps and bounds, I'd like to suggest teaching is in our RNA as well, because we are moving forward, as you'll see by these numbers. It's a key for the future. We are very grateful for the additional $1.5 billion for health workforce that has been provided by the Biden and Harris administration. And from the National Academies of Science, Engineering, and Medicine, their consensus study report that came out in 2021 said, train primary care teams where people live and work. It's one of their 5 objectives. Nearly all health centers participate in some types of training or education, and this slide just highlights some of the work we're doing with our academic ally, A.T. Still University, the health centers that are doing nurse practitioner residency training programs, a concept developed at Community Health Centers, Inc. by Margaret Flinter and her team, 9 states working with the National Institute for Medical Assistant Advancement, 25 states around the country involved in teaching health centers funded by the Bureau of Health Workforce at HRSA, and over 75 health centers that are participating in the advanced education and general residency training general dentistry residency training in partnership with NYU Langone. And what is not on the slide, but is a new emerging Institute for Community Health Workers, which is housed in the Northwest Regional Primary Care Association. Next slide, please. The health center workforce are really the eyes, the ears, the hands, the brain, the heart, and the soul of health centers. We celebrate you. And again, thank you for your commitment and your compassion. And please don't forget to take care of yourselves and your fellow team members. I like to say exercise your body, your mind, and your spirit, as we all need to set aside time to recover and heal. Back to you, Ron.
Thanks, Don. Well, now let me turn things over to our moderator for today's fireside chat, Dr. Grace Wong, who recently left International Community Health Services, where she served as the Chief Medical Officer and provider for many years, to join the NAC Clinical Affairs Division. Dr. Wong is a former National Health Service Corps Scholar, Vice Speaker of the House for NAC's Board of Directors, and now a Senior Fellow of Public Health Integration and Innovation at NAC. So Grace, take it away.
Thank you, Dr. Yee. I'm so honored to introduce our esteemed guest speakers for today's fireside chat. First, we welcome Vice Admiral Vivek Murthy, the United States 19th and 21st Surgeon General. As the nation's doctor, the Surgeon General's mission is to restore trust by relying on the best scientific information available, providing clear, consistent guidance and resource for the public, and ensuring that we reach our most vulnerable communities. Dr. Murthy has created initiatives to tackle our country's most pressing public health challenges, leading the national response to a range of health issues, including the Ebola and Zika viruses, the opioid crisis, and the growing threat of stress and loneliness to Americans' physical and mental well-being. Next, we have Dr. Shantanu Nundy, a primary care physician, technologist, and business leader who serves as a primary care provider at Neighborhood Health, a health center in the Washington, D.C. area. He's also Chief Medical Officer for Accolade. In addition, he's a senior advisor to the World Bank and a lecturer in health policy at the George Washington University Millikan Institute for Public Health. Earlier this year, Dr. Nundy released his book, Care After COVID, which aims to provide a practical plan for reinventing healthcare in a post-pandemic world. And last, but certainly not least, from our health center family, we welcome Dr. Eboni Winford, Director of Research and Health Equity, and a licensed psychologist and behavioral health consultant at Cherokee Health Systems in Tennessee. Dr. Winford is the clinical leader for Cherokee Health Systems Consultation and Training Program, which provides individualized on-site training to other primary care organizations as they seek to integrate their practices. She oversees research initiatives, including those funded by HRSA, the Tennessee Department of Health, and the NIH. Dr. Winford serves as adjunct faculty in the Department of Family and Community Medicine at Meharry Medical College and is a part-time lecturer in the Department of Psychology at the University of Tennessee, Knoxville. So thank you all for being here today, and let's just get started. So Dr. Murthy, we're so pleased to have you with us today. How are you?
Well, I am so excited to be with you today as well. Thank you so much for having me and for bringing everyone together. I'm doing well overall. I have a lot to be grateful for. My 5-year-old just got vaccinated last week, which I'm really excited about. He wasn't so excited when the needle came his way, but he was probably displaying his "I got vaccinated" sticker afterward for everyone to see. And I was able to see my parents over Thanksgiving. So, you know, COVID's been tough for our family, for a lot of families. We've lost family members. We've, had various changes that we've had to make in our family. Our kids haven't been able to see one set of grandparents for 2 years. There's some things that have been tough, but all things considered, we feel very lucky to have our health, to have the prospect of vaccines around to protect our family and friends, and to have a chance to help during a time where there's a lot of work to be done.
Well, thanks for sharing those thoughts. So turning to you, Dr. Nundy, in your book, Care After COVID, you write about the 3 M's, meaning, membership, and mastery, or as you put it, the intrinsic motivation of healthcare professionals. You know, reading about the 3 M's really reminded me of my own experiences as a health center provider, and your description of the 3 M's really captures the essence of the glue that holds the health center team together. Our love for helping patients in our community, the meaning, the camaraderie of the health center team, the membership, and the satisfaction that comes from helping our patients have healthier lives, or the mastery. So Dr. Nundy, what are your thoughts and experience on how to make this glue stronger in our health center workforce?
Well, first of all, I'm so glad that framework resonated. Actually, the attributions from Maureen Bosignano, who was the former head of the Institute for Healthcare Improvement. So she taught me that a number of years ago, and it resonates with me in my practice as well. It's such a good question. You know, I think that, you know, like Dr. Murthy alluded to, this has been a very challenging year and a half for frontline providers and teams, and we know the burnouts are real. We know that the hardship that they face is real. But as I talk to my own colleagues that I still get a chance to practice with, and I talk to folks around the country, there's another thread that we're not talking about as much, which is a kind of fulfillment that they've felt over the past year and a half as well, right? I think Dr. Weaver referred to this in his opening remarks, the kinds of delivery innovations, like real changes on the front lines that we were able to push forward. I think that's the kind of thing that's going to keep renewing that glue, right? I think during the pandemic, for example, I think we truly started meeting our patients where they are, right? We've talked about that for years, but here we were going door to door, canvassing, telling people about the vaccine. Here we were staffing a pop-up clinic. Here we were going to a local church. And I think those types of things, I think us as providers, us as healthcare workers, resonated really deeply with that 3M, right? Because I think we know that the work is oftentimes outside of our walls. We know that the patients that are the most marginalized are often the ones most fearful of coming into our doors. And I think it's that kind of work that I think can fulfill our mission. And I sometimes joke that it's hard to see, but in the past year and a half, I think we've all of us have earned a master's in public health, right? We've all been sort of mini surgeon generals. And I think there's a muscle that we've built now on how do you create these protocols? How do you deliver care outside of the home? How do you look at data in different ways? How do you stay connected to the public health community? And my greatest optimism, even though in the face of all the challenges, is that we take those muscles we've built, that masters of public health, that sort of chance to be a mini surgeon general, and we use that through the rest of the pandemic, but also for diabetes, also for obesity, also to get people their shingles and pneumonia vaccines. And I think that's really going to help connect to those 3Ms and fulfill the reasons that brought us into medicine. So that's kind of how I think about it. And I'm curious, you know, I'll pass the question forward as well. You know, what are your thoughts on how to make the glue stronger, Dr. Winford? I mean, tell me a little bit about yourself and your team. What's been challenging for you, and what's the glue that holds everything together for you and your teams?
Thank you so much for this opportunity to continue this conversation. As Dr. Wong said in her introduction, I am at a federally qualified health center, Cherokee Health Systems. The gift and the curse is that we have 24 locations across the entire state of Tennessee. So yay for access, going to places where people wouldn't typically be able to access care, and most of our healthcare clinics are in the rural areas, and we know about the shortages there. The curse, we have 24 clinics across the entire state of Tennessee. And so when you try to think about centralizing organizations and workflows and processes, it's not going to work. You got to make sure that you're mindful of the needs of each community while still maintaining the core foundation and mission of your organization. Our glue I will say, especially during the pandemic, is flexibility. My very first clinical supervisor ever in life said, "Blessed are the flexible, for they shall not be bent out of shape." And goodness, my slinky and rubber band skills have been activated. But let me give props to my team, okay? So I have at least 70,000 members on my team. And why do I say that? Because Cherokee Health System served approximately 70,000 patients last year. And we have to be mindful that our patients are the most underutilized member of our primary care teams. So my team is big. When it comes to staff and colleagues, though, there are about 800 of us within the clinic that I'm in now, about 10 to 12. We have maintained the glue, created new forms of glue, strengthened the glue as we maintained our flexibility. I will say that we focus very much so on functions instead of just roles, particularly during the pandemic. For example, I've become the best triage nurse there is. I do not have a degree in nursing, but if a patient needs to get triaged into the room, guess who's going to do it? Me, especially when our nursing staff had to be at the front, making sure that everyone was getting screened as they came in. So being willing to fulfill functions of the workflow and not saying, "Oh, that's not my job," I think has really held us together. And if we can learn from that, we've been stretched in so many ways, practicing at the upper limits of our training during these past year and a half. I think we can keep that glue together. And as an aside, I actually did earn a degree in public health over the past year and a half. I decided to go back to school during the pandemic, so I did get that. Yeah. Back to you, Dr. Wong.
Well, congratulations to you, Dr. Winford, and Dr. Nundy. I know you need to hop off now, so thank you so much for participating in today's discussion on the importance of our health center workforce. So it's my honor to now turn back to you, Dr. Murthy, for the next question. According to the National Academies of Science, Engineering, and Medicine 2021 Consensus Study Report on Implementing High-Quality Primary Care, a defining feature of a care team is its stability. What are your thoughts on how to bolster team stability in the health center workforce?
Dr. Wong, it's a really good question. And I think that the environment within our clinical care centers is one of the biggest determinants of clinician well-being. I think of the quality of care that we provide and also the stability, as you mentioned, of care that we provide. There are a few features that I think are very important to those, to that sort of stability, if you will. I think number one, building in both a culture and process of collaborative care is so important because I realized in my own training and then talking to many colleagues in the healthcare setting that healthcare can become very isolating very quickly in many models. You can, end your days, even though you're physically surrounded by lots of people, feeling like you're on your own, making decisions, having to do follow-ups, be accountable for everything that happens. There's tremendous power, though, to building a model that allows people to truly feel like they're part of a team. We know that in reality, this is actually what's best for patients. It turns out it's actually what's good for clinicians too, in terms of their own well-being. I think the second thing is just to recognize that clinician well-being itself should be an independent work stream and an area of focus, because the well-being of our clinicians is really not in a good place right now. Burnout rates were high pre-pandemic; they were higher post-pandemic. During this pandemic, but we know that has an impact not just on clinicians dropping out of the workforce, but also on patient care and medical errors down the line. And I think for too long it's gone unaddressed, if you will, the challenges that our colleagues are facing with stress, with anxiety, with depression, and with burnout. Suicide rates among clinicians have been extraordinarily high for a long time, much higher than the general population. So I think that if we really want, healthcare delivery teams that are able to execute and are stable sort of primary care elements there, we've got to focus also on clinician well-being. And we can talk about some ways to do that, but I think that has to come from a combination of factors, which include cultural change, improving, building a culture effectively that supports well-being and prioritizes. It doesn't look at mental health struggles as a source of weakness. It has to come from actually making mental health services more readily available to people. And when that comes in the context of a culture that supports mental health, people will actually avail themselves of those services. It's not enough to just make them available. People have to feel that they're in a culture where you can use it. But then the workflow itself, the quality of the work we have to look at. And I think it is no secret that many clinicians have felt burdened, if you will, by the extraordinary amount of paperwork and a number of regulatory burdens that they're dealing with, as well as EHRs, which more often than not feel like they're set up for billing rather than patient care. And so you put these together and you have a very familiar point of concern from clinicians that they're spending more time with paper and screens than with patients and families. And that is a recipe for burnout as well, because I can't remember a clinician who I talked to who said, I really want to become a doctor so I can chart, so I can spend time in front of a computer. Nobody says that, because it's just not true. And we're depriving clinicians, I think, of one of their greatest sources of joy and of satisfaction, and that is their time with their patients. So I think that's another important point, is building that sort of pathway and focus on well-being. A couple last things I'll just mention here also is that I think community matters a lot. The more we learn about loneliness and isolation, how prevalent it is in the country and really the world, but in particular in the medical profession, we learn that that community is really an age-old antidote to despair and stress, right? And think about it, like when we have hard times, many of us, what do? We pick up the phone and we call somebody that we care about to talk to them, or we get in the car and we try to visit somebody that we care about, the COVID safe way in these days. But the point is that we reach out to other people and figuring out how you build a true community inside your workplace where people know and understand each other, where they feel valued for who they are, not just for their skill set, and where they feel like they truly belong. Those are incredibly important aspects of having a healthy work environment. And you're seeing it outside of healthcare right now. There's been a lot of news written and stories written about the Great Resignation, people quitting their jobs, moving on, sometimes moving on to other things, sometimes not moving on to anything, but just saying that, gosh, the pandemic has just shifted how I think about what I need from work. One of the most common things that people talk about in the surveys that are done there are about the need for a place that confers belonging, the need for a community. That is so, so important. And you can't replace that entirely by bumping up somebody's paycheck. That's not to say that a living wage and a fair salary are not important, but just to say that that is one part of a larger sort of set of issues here that we have to address to truly create healthy workplaces. So those are, I think, some elements to creating a truly sort of sustainable and stable primary care structure. And finally, just remind people that we all feel good, like when we are connected to the people and the communities we're serving. But it has so many times can happen that I remember this in training, that you can be practicing in a community and be so head down that you cannot really understand or get to know the community around you, because you just don't have time to go out and engage and meet people actually out there in the community, see people outside of the healthcare setting. I think whenever there are opportunities to strengthen that connection between the community and the clinicians, whether that's helping them meet and engage with organizations that are pivotal, build partnerships with organizations that can continue the work afterward, that makes a really big difference. Because I always think about this example I heard of years ago of a YMCA that collaborated with a hospital in Iowa once, and they realized when the clinicians at the hospital needed their patients to exercise and engage in diet change, but that was incredibly hard to do. They didn't have the resources to follow up. And you had the YMCA, which had the resources to actually build and run those programs. It was wondering where the people were. And there happened to be a board member of that local YMCA who was also a clinician at the hospital, who had the idea, hey, why don't we build a community collaboration here where clinicians can, rather than feeling like they have to manage the entire process of lifestyle change on their own, can refer people to the YMCA. And then they can plug in to an exercise or a diet and nutrition program there. And that's what they did. But that became such a satisfying collaboration for the clinicians and for the YMCA, because I think one of the great triggers of burnout is when you feel like you can't do your job well. And if you, as I and many other clinicians have had the experience of seeing a patient, let's say with diabetes or hypertension in the clinic, and knowing that the big thing that they need to do is centered around access to healthy food, or centered around exercise, where they live in a neighborhood that's not safe and it's hard to walk around, they don't have the funds to afford a gym membership, then sometimes you're left with feeling like all I can really do is tinker with their medications and titrate their antihypertensives or their insulin. And sure, that might be important, but when you know that the big issue is something that you can't contribute to, that's frustrating, it's saddening, and it contributes to a lack of self-efficacy that clinicians feel, which is where these community partnerships can be good for patients, good for clinicians, and ultimately good for the broader community.
Thank you so much for emphasizing that community connection. We totally agree with what you say. Thank you for that. And turning back to Dr. Winford, I understand that NAC received numerous questions from the audience for today's session. And there's one question in particular that raises several important issues, and it's about our rural healthcare workforce and resource gaps, specifically how to bridge those resource gaps for our communities of color.
You know, I could spend a whole day on this topic. I will not. What I will say is that, again, Cherokee Health Systems has 24 clinics. Only 8 of those clinics are in what we consider urban areas. The remaining 16 are in rural areas. And those 3 urban areas are Memphis, Chattanooga, and Knoxville. The rest are very, very, very rural Appalachian locations. So most of our clinics have been placed in communities such as these that are facing those workforce shortages. The last time I checked, it would take about 18,000 physicians to improve the access for people in rural communities compared to metropolitan communities. Now, when you think about like the demographics of rural populations, though, of course, we're going to see higher proportions of lower income and minoritized people. And those individuals in general get dealt a tough hand. With COVID, they were most likely to be diagnosed with COVID and or to die or be hospitalized of COVID. And then there's some particular issues that I think our communities of color in rural communities face, particularly as we're seeing access to specialty providers get diminished over time. One of the primary ones for me that rings very true is the OB-GYN shortage and the increased Black mortality rate following birth, particularly in rural communities where there are fewer and fewer specialty providers, fewer and fewer providers to deliver healthy babies. We have people who are at risk for mortality to start with, and now they have less access to the resources to provide for their care during the pregnancy and delivery, and now their mortality rate is increasing. We also see with opioid use disorder, what resources exist in our rural settings for either detox or for treatment. And of course, there's some hesitancy about providers wanting to prescribe medication in the office to help with that. There's just a lot of things that our rural communities face. And then if we layer on top of that racism, right, and inequities and disparities that already exist, disparities in COVID, disparities in other chronic conditions like hypertension, diabetes, and things like that, we're seeing like what we're calling a syndemic, right? So there's COVID, there's racism, there's public health, there's all the things coming together, and then you take away the resources. So there's no healthcare provider to help address the depression that may come from the loneliness that Dr. Murthy talked about. There's no one to help deliver the babies. Funding for these rural community centers are being drawn away. And I know that we got so much funding and redirection when it came to telemedicine. In our 16 clinics that are rural, there are a few of them where people have to step outside to use their cell phones because there is no service. So even though we have telemed, is it accessible by the people networking or utilizing those services? One of the most heartbreaking experiences I experienced during COVID is I had a patient I was communicating with via telephone monthly. 1 month I couldn't reach her because her minutes died on her phone. She was using the Lifeline phone. When I finally got in touch with her, she said, "Oh, I used all my minutes last month because my brother died and I had to make funeral services." So connections like that, or make funeral arrangements, connections like that, we take for granted when we tout how awesome telemed is, because is it accessible to everybody? I think about these things in terms of equity as a goal and a process. Like if the goal is to make sure the barriers have been removed, what do we do to remove the barriers? We can't just say, here's telemed, here's a clinic, go in there, without problem solving how to make sure people can utilize those resources we put there. Finally, I want to say we need representation. In the United States, 4% of psychologists are Black. So you're looking at one of them. I never saw anybody who looked like me when I was growing up, providing this type of care. For our ethnic minority and people of color in rural communities, they are disproportionately lacking representation. No one looks like them because no one wants to come work there. No one wants to stay there. No one wants to be retained there. So what do we do to fix that? I really think we got to focus on some targeted recruitment strategies, making sure that we're creating pipelines. I know, again, I didn't have a Black psychologist to look up to as a mentor. We need to create those things for people who may not have exposure to professional mentors. Policy, of course, right? Like we can't do this on our own. We need the money. There is money. I was looking at the most recent Health and Human Services Strategic Plan for Workforce. There's some good plans going on, including money. We have the Health and Human Services with the National Health Center Service Corps, helping to reimburse people willing to go to rural locations. But without action, just saying there's a problem in the rural communities means nothing. So we got to bring the money, we got to bring the pipelines, we have to bring the representation. We've been thankful enough to have a mobile clinic. So we've been able to drive to some of those places that may not have the broadband internet, that may not have cell phone services that would allow us to remain connected for care. And those have truly been some of the most fulfilling times, because our mobile clinic does have internet. Our mobile clinic has a medical provider, a nursing provider, a PrEP navigator for HIV prevention, access to a behavioral health provider on demand, nursing, phlebotomy, whole 9 yards. So we have been going to where the need is. And I think we need to think outside the four walls of our healthcare systems if we're going to overcome these shortages and barriers that we see in rural communities and minoritized communities as a whole.
Thank you, Dr. Winford. And I really appreciate you also sharing some of the potential solutions that you all are working on. Dr. Murthy, what are your thoughts on the rural healthcare workforce and bridging resource gaps for our communities of color?
Well, thanks, Dr. Wong. I thought Dr. Winford spoke very eloquently about that and accurately. I completely agree with what she said. I think this part about the diversity of the workforce in particular is so important. I mean, we've seen that, we see it all the time, but particularly during the COVID-19 vaccine effort, we saw so many patients find greater comfort and trust when talking to clinicians who share their life experience, came from a similar racial ethnic background. Sometimes that was because they had, bad experiences with the healthcare system before, but sometimes it wasn't. Sometimes it just helps to know that the person you're talking to comes from a similar background, understands you, and can talk to you about these kind of complicated issues, like how to deal with COVID-19. So I do think that the diversity of workforce is really important. And I'm alarmed at how we have in some ways slid back on that, in recent years in terms of representation. That's a big deal going forward. There are a couple of things I think that have happened that are positive. I think they're moving us in the right direction. And I think, look, COVID has highlighted so many things for us that were broken that need to be fixed. Equity being chief among them, both racial equity and geographic equity, with rural areas often being disproportionately hit by healthcare issues, and healthcare access being one of them. Recently, just last week, in fact, Vice President Harris had announced an additional $1.5 billion that's now going toward scholarship and loan repayment for for trainees who basically commit to working in underserved areas. It's on top of the existing funds for the National Health Scholars Program. One additional step in the direction of helping us to get more clinical care providers in rural areas. There have also been some significant investments the administration has made through the American Rescue Plan in broadband access, and also through the recent infrastructure bill. That recent infrastructure bill, by the way, more than $40 billion into closing that broadband equity gap, which, if you don't have broadband access, you can't have telehealth, right? And we know that's a problem for many areas, and particularly many rural areas. So these investments, both in the broadband infrastructure and in telehealth, are very important. It's not all about money, though, right? Some of this is about regulatory changes, right? And making sure also that payers are willing to reimburse for telemedicine, to make sure that we take down barriers to the implementation and utilization of telemedicine. I'll give you a simple example. Like, there were clinicians I heard from, I remember, a year ago, who were saying, we're getting now reimbursed for virtual care appointments done by video, but we're not getting reimbursed by phone, for certain, by certain payers. And you think about that and you're like, oh, that doesn't make sense. Somebody may need to talk to their doctor, and they may have their phone on them, but they may not have the capability of doing a video consult. And so there are regulatory issues like that. And there are also just, among private payers, rules that need to be aligned with the broader goal of increasing access to patients, particularly in rural areas. But I'm encouraged by some of the investments we've had. And more broadly, I should just say the investments in community health centers. More broadly, President Biden, as many of you know, is a big believer in community health centers. And he and others were, to them it was very important that we invest in community health centers, not just for vaccine development and vaccine administration, and CHCs are a huge engine and continue to be in administering vaccines, but also more broadly to support care and close care gaps. Like one of the things I think we as a country just owe such a debt of gratitude to CHCs for are, number one, being a source of care during an incredibly difficult time during this pandemic. It was not easy to provide care, as all of you know. There were a lot of uncertainties early on. People weren't sure who to trust, where it was safe to get care. But you were those safe, trusted places for millions of people all across America. That mattered a great deal, not just for their physical health, but just mentally and psychologically to know there is a place I can trust, there are people I can trust to get my care. That makes a huge, huge world of difference. He certainly understands that. The administration has understood that, and that's why the additional billions of dollars that have been invested this year in community health centers is so important, and it's what we need to do because this is how increasingly more and more people are going to need to get their care. Finally, I'll just say that the workforce piece that we were mentioning earlier in this conversation, I think is still important here. Not just how to get the right number of people, but how to make sure they're taken care of, that their well-being is a priority after you bring them into the workforce. It doesn't make any sense to have a growing number of people in the pipeline if the pipeline burns people out and then spits them out on the other end, right? We've got to make sure we're actually taking care of people in the process. And this is why, the final point that we had talked about in the earlier question about building connections between the clinic and the community are so important because, you imagine you're a new healthcare provider coming to a rural area to provide care. One of the reasons that sometimes people leave and go back is they don't feel like a sense of community or connection, right? But we know when people build those local ties, not only does it make their work more satisfying, it makes them more willing and able to stay. So I do think that, again, paying attention to community and well-being for clinicians is going to be an important part of how we also enable them to stay in rural parts of the country where we so deeply need clinical services.
Well, thank you, Dr. Winford and Dr. Murthy, for responding to that important question. As we come to the end of today's conversation, Dr. Murthy, I'd like to give you the opportunity to share any of your final thoughts.
Well, thank you, Dr. Wong. First, I just want to say thank you again to everyone here who has been part of this extraordinary community of community health centers over this, and not just over the last many years, but in particular over the last 22 months. This has been a really tough time to be a clinician. It's been a tough time to have so many people rely on you, looking to you when you yourself might have, at many points in these last 2 years, wondered what the answers were. I've been uncertain about what the right path forward is. It's one thing when you've got a patient who's got an illness, you know exactly what to do, and you've got the resources at your fingertips to deliver. It's a whole other question when the answers aren't so clear and the resources aren't available. But that is what you not only deal with every day, but what you particularly had to contend with during this pandemic. I will tell you also at many points when we were talking about the vaccination effort, at HHS and the White House and mapping out the broader strategy, community health centers came up all the time. And you see that reflected in this strategy that was ultimately rolled out. So I think there was a recognition, not just here, but I think a growing recognition in the country that community health centers represent a critical backbone of our health system, not just because there are healthcare providers there, not just because they're physical buildings that exist in communities, but because of an intangible that you have built, because of your integrity and hard work, and that is trust. And vaccination campaigns move at the speed of trust. Healthcare moves at the speed of trust. Without trust, we can't deliver care to people who need them. That is the currency that you have built, over years and years of incredible hard work and sacrifice. And I just want to recognize how valuable that is in our ultimate goal, which is to provide good, equitable care to everyone. And finally, I just want to recognize this moment that we're in, as painful as it has been. And while at times it seems like it's never ending, especially with a new unknown variant on the horizon, I just want to remind people that we have come a long way. in the last 22 months. And just think about this, a year ago, just 1 year ago, we didn't have vaccines available to give people. We didn't have the prospect of two oral therapeutics, on the horizon that might significantly reduce the risk of hospitalization and death. We didn't have, monoclonal antibodies available to the extent that we have now. We did not have so much of what we have right now. And what that's enabled us to do is save a lot of lives, frankly, and keep a lot of people out of the hospital. The fact that so many people still are losing their lives and are hospitalized from COVID is a testament to just how robust and hardy the Delta variant is. And it's a tougher foe than what we were dealing with last year. But we've continued to see even there, if we can get people vaccinated and boosted, we can help them, we can protect them. And some of these other measures that all of you have been advising your patients on and that you have been advocating for in communities, including masking and better ventilation and making sure that people have the opportunity to test whenever possible. These are also strategies that we know help to reduce risk. So we are in a better place. We have so much more know-how about how to protect ourselves. But to me, one of the greatest ways that we can honor the people who have lost their lives to this pandemic, including a number of my family members who have lost their lives and many of your family and friends who I suspect folks on this call have lost loved ones too, to the virus. I think one of the greatest ways that we can honor them is to make sure that we build a healthcare system, a public health system that makes this kind of toll much less likely in the future, that actually provides the kind of care to people that they truly need and deserve, and does so in an equitable way, and recognizing that equity is more than a buzzword. It's more than a box that we check, right? It's more than in the numbers that show up on a spreadsheet or on an output report. Equity is really fundamentally a value. It's about how we choose to see the world. And I use that word choose intentionally because just by coming together, right, as a community, we made a decision that we want to be together, that there are certain rules that we want to live by, values that we want to build our community on. And those values were very clear to people like my parents, who are immigrants who came to this country 4 decades ago. But whether you came 4 decades ago or a couple hundred years ago, or whether you've been here all along, the bottom line is we made, in some ways, a decision by being a part of a community that there are certain values that we wanted to live by. For my parents, those values were the notion that our kids would be able to grow up and live in a society where they were treated fairly and where they were respected because they were human beings, where they were given access to opportunity and to resources, not because they were connected or because they had the right last name or because they belonged to a particular racial group or caste, but because they were human beings who had just as much value and worth as any other human being. And there have been times for sure when they haven't seen those values played out, in society. But I will tell you that there are many times where we have seen those values played out. We've seen the generosity of public school teachers who made sure that my sister and I, even though we were, funny looking kids with funny sounding names, that we had as much attention and opportunity, as other kids did. We were the beneficiaries of a healthcare system that made sure that when we got sick, and there were times where we did get sick, that we could actually get care, that my parents could rest assured at night that if a healthcare need arose, that they wouldn't be a parent who couldn't provide for the care and well-being of their children. But we know that not everyone has that experience. And I think part of what drives me in this broader quest to make equity a reality is a recognition that this is the value that so many of us want to see reflected in our country. It's the kind of world that we want for our children. Long after we're gone here and our children inhabit this country and are leading the world, we want them to live in a world where they have a good shot at leading a healthy life, where the healthcare system will be there for them, where there's a public health system that's there to help keep them healthy in the first place. This is what we want for our kids. And that's why equity is so important right now, where we can't lose this opportunity to make it a permanent fixture, the central value that we build and rebuild our healthcare system around. And all of you are incredibly important agents in that change process, not just through the work you do, but through the advocacy that you provide, because your voice has great strength. And I know sometimes it can feel like it doesn't when you're out in the field and you're, slogging on your own in an exam room and you're wondering, God, is anybody listening to the concerns we have? Does anyone care? I want you to know that people are listening, people care. The people that I work with each and every day in this building, they care deeply. They hear those stories. Many of us are clinicians ourselves and have lived the experience of providing on the front lines with limited resources. And I hear people on a daily basis stand up and speak up for the needs of clinicians on their front lines. So I want you to know that we see you, we hear you, we feel immense gratitude for you for what you are doing. And I'm just so grateful for the opportunity to join all of you today.
It's really been an honor to have all of you here today, Dr. Murthy, Dr. Nundy, and Dr. Winford, and to my health center colleagues as we look towards the end of the year and all we have achieved as a health center workforce network. I am humbled and motivated by your contributions. So I'm turning it back to you, Dr. Yee, to close us out.
Thank you so much, Grace. And as our speakers confirmed today, the health center workforce is such a vital part of our healthcare system, providing care to services to over 29 million patients every year. And NAC is honored to celebrate and represent the voices of the over 14,000 nonprofit community health center sites, their staff, board of directors, and patients across the nation. And speaking of celebrations, over this last year, NAC has marked its 50th anniversary with monthly fireside chats like the one you participated in today, offering an opportunity to highlight the impact community health centers are making every day across America, especially in this time when we're still fighting COVID-19. So on behalf of NAC, I'd like to thank you all for attending, our esteemed speakers, Grace, our moderator. I invite you to join us next month on Tuesday, December 21st at 2 p.m. Eastern Time for our final webinar in this series, when we'll be looking ahead at NAC's next 50 years and hearing from our staff and how they plan to play a role in the future of health centers and NAC. So wishing you all a safe and healthy holiday season. Take care.